Lesson 5 covers medical emergencies in the imaging suite. A radiographer who can recognize and respond to an emergency is the difference between a good outcome and a catastrophic one. We're covering cardiac arrest and CPR, allergic reactions, contrast emergencies, vasovagal responses, respiratory distress, and diabetic emergencies. 6 minutes. This content saves lives. If a patient loses consciousness, has no pulse, and is not breathing normally, that is cardiac arrest. Your response is immediate. Call for help and activate the emergency response system simultaneously. Do not leave the patient to go find someone. Begin CPR if trained, and if there is no DNR order on the chart. 30 compressions, 2 rescue breaths, repeat. Push hard, at least 2 inches deep, and fast, at least 100 compressions per minute. Allow full chest recoil. Get the AED on the patient as soon as it arrives. Attach, analyze, shock if indicated. Do not stop until the crash team arrives and takes over. Time to defibrillation is the most critical factor in survival. Allergic and contrast reactions range from mild to life-threatening. Know the categories. Mild reactions: nausea, vomiting, urticaria, which is hives, flushing, and mild itching. Monitor and document. Usually self-limiting. Moderate reactions: diffuse urticaria, bronchospasm, facial edema, and tachycardia. These require active treatment. Notify the radiologist immediately. Severe reactions. Anaphylaxis is the life-threatening extreme. Laryngeal edema, severe bronchospasm, hypotension, and cardiovascular collapse. This is a full code. Epinephrine immediately. Activate emergency response. Vasovagal response is one of the most common emergencies you will see in an imaging department. It's a sudden drop in heart rate and blood pressure triggered by anxiety, pain, or prolonged standing. Symptoms come first: pallor, diaphoresis, which is cold sweating, nausea, and lightheadedness. Recognize these signs before syncope occurs. Your response: lower the patient to a supine position immediately. Elevate the legs to improve venous return to the heart. Maintain the airway. Monitor. Notify the nurse. Offer water when the patient is fully responsive. Most vasovagal episodes resolve quickly with proper positioning. The danger is the fall and injury, not the episode itself. Signs of respiratory distress: increased respiratory rate above 20, use of accessory muscles, nasal flaring, cyanosis, a bluish discoloration around the lips and fingertips, diaphoresis, and an SpO2 dropping below 90. Your immediate response: sit the patient upright if possible, as upright positioning reduces the work of breathing. Call for help. Apply supplemental oxygen only with a physician order. Do not leave the patient alone. Causes in the imaging suite include contrast reaction, pulmonary embolism, asthma exacerbation, and anxiety-driven hyperventilation. Your job is to recognize and escalate, not to diagnose. 2 diabetic emergencies you must distinguish. Hypoglycemia, low blood sugar, presents with diaphoresis, tremors, confusion, pallor, and rapid heart rate. The patient is often anxious and sweaty. If conscious and able to swallow, oral glucose. If not, call for help immediately. Do not give anything by mouth to an unconscious patient. Hyperglycemia, high blood sugar, presents more slowly. Dry mouth, frequent urination, fruity breath odor, and gradual confusion. This is a medical situation requiring provider evaluation and IV access. The key distinguisher: hypoglycemia comes on fast. The confused, sweating patient in your suite who just came from a fasting prep. Check glucose first. Every emergency follows the same core sequence. Recognize the emergency. Protect the patient from injury. Lower them if there's fall risk. Activate your facility's emergency response system. Do not leave the patient alone. Perform basic life support if indicated. Stay calm, communicate clearly to the response team, and document everything: time, symptoms, actions taken, and personnel involved. Know where your crash cart is before you need it. Know your facility's emergency phone number before you need it. Know whether your imaging suite has an AED and how to use it. Preparation is the only emergency management strategy that actually works. 3 emergency questions. Think them through before the answer drops. The answer is B. Moderate reaction requiring treatment and monitoring. Diffuse urticaria bronchospasm and facial edema represent a moderate contrast reaction. Active treatment is required. Notify the radiologist immediately and be prepared to escalate to severe response protocols. The answer is B. Rinse the affected area with water for at least 15 to 20 minutes. For chemical skin exposure, immediate copious water irrigation is the universal first aid action and is specified in the SDS First Aid section. Remove contaminated clothing during rinsing. Seek medical evaluation if irritation persists. The answer is C. Notify the referring physician of the dose and arrange patient follow-up for skin assessment. Emergency imaging should never be withheld solely due to radiation dose. The clinical benefit outweighs the risk. Notify the physician when dose exceeds 1 gray at the reference point and arrange follow-up at 10 to 14 days. You covered cardiac arrest, contrast reactions, vasovagal response, respiratory distress, diabetic emergencies, and the core emergency response protocol. These skills protect lives. Keep building in the practice section.